Not really a good day if you look at the number of COVID cases that's happening right now globally. There are 54 million cases and 1 million deaths. And if you look at in the United States alone, based on the Johns Hopkins University, there are 11 million cases and around 246,000 deaths, which will really tell you, how complicated and how difficult it is right now. I want to talk about how you're doing and what are the tips and tricks. What can you do knowing that COVID-19 is here and it's probably going to stay within our communities for a long time.
Okay, let's try something different.
Hey everyone, this is Dr. Lowell Sala of NYC Emerging Healthcare Technology, your go-to place if you want to learn more about blockchain, machine learning, artificial intelligence, data science, and web development in healthcare. And also if you want to learn more about digital health. Before I begin, just a caveat. So right now, if you are suffering from depression or somebody who's suffering from depression and there's a high chance or high probability of suicide or suicidal ideation, then there are a lot of hotlines that you can call through right now. You can dial 911 or the National Suicide Prevention Hotline and even the Veterans Crisis Hotline. Tell me that you love me, even if it's fake. I want to start by talking about the 5 stages of grief because I think it's very important, especially when you talk about coping mechanisms for all human beings. So if you're a fan of Kubler-Ross would tell us that the first stage of grieving or the grieving process would really be denial, and then after denial you go to anger, then you go to all this bargaining, and then depression, and the last one would really entail a huge aspect of your life, which is really acceptance. And I think it's very important for us to understand that everyone is going through this because the COVID-19 pandemic is affecting not just ourselves or our families, but entire communities, especially communities of color. So this is why I really wanted to have this discussion to talk about how we can achieve this, how we can help ourselves in terms of this COVID-19 pandemic. So we all know, for example, that everyone reacts differently to different stressful situations. So some of us may have good coping mechanisms. A lot of us may not have good coping mechanisms. So we have to be very careful, especially to people who are at higher risk from COVID-19. People who are elderly, people who have underlying medical conditions, for example, people who are suffering from HIV/AIDS, people who have diabetes, people who have hypertension, people who have cancer, for example, and are taking chemotherapeutic agents. So this should be emphasized that we should be very careful in dealing with COVID-19. So we have to make sure that they are not affected because the implications of them being affected would really destroy their immune system. And other people would especially people caring for family members of loved ones, children and teenagers, frontline workers, for example, such as healthcare providers, and then the first responders and essential workers who work in the food industry. And to talk about the coping tips or coping mechanisms, I think the first advice that I could give, I've been giving these advices ever since I was a young medical doctor in the Philippines when one of my patients actually suffered a catastrophic death of the family. And one of the first things that I tell them is taking a break from social media. So if you have a lot of social media, for example, if you're doing Instagram, if you're doing Facebook, and if you watch the news every day, sometimes it adds to your level of anxiety. So it's very important for you to take a break from social media every now and then. And we always tell, as physicians, we always tell our patients that it's important to take holistic care of your body. And part of taking care of your body holistically would be taking not just your physical aspect, but also your emotional and psychological and psychosocial aspect. So part of this would really be doing meditating. In fact, I actually have a video here that talks about how to meditate, especially if you're a frontline worker, for example, or if you're so much the level of anxiety is so high You can do meditation 10 minutes. So there's 10-minute meditation, there's 30-minute meditation that you can do. I have the meditation that I do every day is actually a 10-minute meditation. And it's also important to have a proper diet. So eat healthy, eat green leafy vegetables as much as possible. Refrain from eating fatty foods and oily foods, because in fact a lot of studies are showing, especially in COVID-19, if you are obese, the chances of getting sick is really a lot more difficult. And it's important for your immune system to also be more healthy. And which is why I also advise, and this is actually what I do regular exercises every day. I run every day. I try joining marathons. Right now there's no major marathons, but I try to was just run around Central Park or Prospect Park, and really try to be as active as I as much as I want to be. Social distancing rules are also very important, especially in this day and age, because you don't know, especially because a lot of people who are asymptomatic may be carrying the virus. So it's also important to take care of your emotional health. So make sure that you're still able to talk to your therapist and have heart-to-heart discussion with your loved ones, for example. And since today there are a lot of people who are doing remote work, it's also important to create a structure in your daily routine. By structure, for example, if I'm not really a stranger to remote work, but some of you may be a stranger to remote work, and this is probably the first time you're doing remote work. So make sure you create a structure, a system to mimic that when you're working. So for example, if you go to the office, initially you have 30 minutes to an hour to get to the office, and then another minute to an hour to go back at the end of the day, right? So it's important so now that you have additional time, you can actually prepare yourself, like wear a coat and a tie, and wear a shirt, a proper shirt, so that you will be able to mimic as well your experience in the office as well as your experience in working remotely or working at home. So these are all very important aspects, because I think we need to understand that the structure is actually helping you cope with the changes that's happening right now, especially in terms of remote work. So I always advise everyone to take time to unwind and commune with nature. In fact, one of the advices that I give to my patients before is when we talk about one of my patients, actually at the time was diagnosed with cancer, and was asking me, how can I, he was already starting treatment, he was already starting with his chemotherapeutic agents. There's both chemo and radiotherapy. And one of the things that I advised him was really, spend an hour or a day just being with yourself. I know that it takes a lot of time, especially if you have a lot of businesses, for example, if you come from a big family, if there are instances where you really need to interact with people. It's important to spend just a day just for yourself. You can do whatever you want with that day. You can relax, you can watch TV, for example, or you can just commune with nature and just be with nature, just walking, and it helps you become more, it helps you become more entwined with nature, and in that sense it actually helps your immune system, it boosts your immune system. So another thing that I think it's also very important to talk about is connecting with others, especially when we talk about preventing isolation. I think one of the major issues that this pandemic is actually doing is creating a sense of isolation, that you're alone in this world. And I think social media does that. It helps, even with social media, it helps in a way, but the more that the people are actually connected, the more that they feel isolated. So I think it's important not to understand that social media may be a tool, but at the end of the day, it's more important to find your community, to be a part of that community. So there are a lot of communities out there, a lot of places where you can be a part of, a lot of places where you can share your expertise. For example, if you like technology, there are a lot of technology communities. In fact, one of the things that I actually advise is to be a part of a meetup group.
It's hard to breathe, but that's alright. Hush.
And another thing that I want to talk about and want to give attention to are people recovering from COVID or those who are ending home isolation. I think it's very important for us to recognize that you if you're suffering from if you've recovered from COVID or ending home isolation, it's important to recognize that there are mixed emotions that you might be feeling. Fear and worry is one of them, and there are two aspects that a lot of that's really being considered here. The first one is the physical aspect, and the second one would really be the financial aspect, the financial impact, especially if you've lost your job and don't know what the future is going to be like. So it's important for everyone, for us to recognize that these are normal feelings, and this COVID, this pandemic has really uprooted, it's really changed the landscape of not just jobs but how we see the world. And we are going to go through all this together, and only through together we will be able to survive and surpass all this. And I want to end by mentioning in my last slide that there are a lot of hotlines right now. So if you're feeling depressed, if you're feeling bad, and there are a lot of hotlines that you could call that can help you, and there are a lot of communities out there that are willing to help you with whatever it is that you're going through. So with that, I would like to end. I would sincerely like to thank you for listening to this video, and if you want to learn more about this video, if you want to learn more about what I do, please make sure to click that subscribe button so that I can also go on making a lot of videos such as this one.